Hello. I've just done a great session with a patient with a slightly less stable shoulder, and we were starting to work on a bit of like scapular control around the rib cage. And I just thought I'd do a video of the things that we went through, partly for him and partly for future patients. So what we're looking at is kind of imagining the spine, so the upper back, travelling down into the lower back, and then the scapula as a kind of triangular shape moving around that. So what we're aiming to do is start to get a bit of separation, but like active movement into a broader shoulder complex. So trying to find that active moving away that's really beautifully supported, and then being able to come back in towards the spine with the shoulder blade with control, and then finding that movement away. And then we're also looking at, can we then stabilise there? And then can we start to lengthen tissues and move around that as well? So we're going to start off first moving more dynamically. So we're going to visualise the line of our upper arm. We're going to visualise the line of our spine. And we're going to do something called the kind of cat-cow movement. Some of you might know that from yoga. So like the hands and knees where we're rounding and then arching. But we're going to do that from a lateral point of view. So we're going to start to move our spine one way and then the other. So first of all, we're going to let our rib cage kind of collapse down towards the wall. So that might mean that then the shoulder blade feels like it comes in towards the spine. And then we're going to press really actively into our palm and our elbow and push up and away. And we're going to curve our body away from our arm. So we're going to feel maybe like our shoulder blade starts to reach out. You may feel around kind of the side of your rib cage that you can actually get hold of your shoulder blade, like the edge of your shoulder blade in this position. So you might feel that just to give you a bit of extra feedback as to what's going on there. And then feel when you collapse that then disappears again. So that's coming in towards the spine, and then shoulder blade presses actively away. So you're really, the kind of direction of press is through your elbow bone. So pressing into the wall. So you're going to really push away. And I'm feeling really active kind of all the way through my shoulder there. Really contact your hand on the wall as well, and then sink back down. So that's your kind of cat-cow movement, that kind of slight like concave convex spine, but sideways, and really using that kind of press out through the elbow to guide that. Now from there, we're now going to position ourselves, and we maybe have a slight lean against the wall, nothing too acute. And then we're going to see, right, can we just really actively support ourselves there? You may choose to reach fingertips out and see, can I get really broad there? And from that position, you might then think, okay, can I reach up? And can I reach over? That's a really lovely stretch. But again, there's that onus on the shoulder and the arm and the shoulder blade to be really supporting and really active there. So I'm now moving into a bit of fatigue, partly because I've been teaching this, but also partly just because I'm working really hard around this area, even though it just looks like quite a subtle movement. The other way that we can add a bit more oomph, and obviously we'll be doing this both sides, although I will have told you if there needs to be more of a focus on one side. But I can then think, right, can I be in this very slight angle against the wall just to ask a little bit more of my shoulder? Can I press into my hand, actively into my elbow, push away, really actively drawing up through the crown of my head as well. So my core's really working hard. I can feel my obliques, side of my rib cage coming into my lower back. And then I might just do some delt raises. So in this position, like you could be doing some overhead presses, you could be doing some rotator cuff here. But what I'm doing is I'm working out one shoulder more dynamically whilst I'm also building the stamina on the other shoulder. So if you have a bit of unilateral work, you can even add in this kind of wall plank as a really nice kind of added extra. And by the time you've done that, you'll have quite a tight shoulder. But we're just really looking at, can we start to get that stamina? And for context, this was somebody who's working on feeling stable whilst reaching, and that reach involving the rib cage, involving reaching the shoulder blade. And that then means that then the socket of the shoulder joint is angled correctly for your rotator cuff to work optimally. So it's kind of optimizing your shoulder joint in terms of the ball and socket joint, but by getting all the other bits from spine, rib cage, scapula working congruently, working in synergy in order that the shoulder can be at its best. So as always, any questions, anything you're not sure about, just drop me an email and I can answer. Don't work into these positions if you don't feel stable or safe, and be really respectful of any acute pain. You should really only be feeling like a diffuse fatigue around this area. You shouldn't be feeling sharp acute pain anywhere. If you do, feel free to email me. Take care. Bye.